Emerging infectious diseases are found throughout the world, but many of the diseases are localized to areas near the equator. This region presents a habitable environment for viruses. One country found near the equator is Laos. Laos is a tropical country in Southeast Asia with a population of approximately 7.2 million people with an average life expectancy of about 65 years. Every year, cases of dengue fever are reported in Laos, making the disease endemic to the region. Dengue fever causes symptoms such as high fever, joint pain, muscle pain, and in severe cases, hemorrhagic fever. Currently, no medications are present for the treatment of dengue fever, but symptoms are treated with acetaminophen. Acetaminophen can help relieve headaches and lower fever, but the exact mechanism of action for the drug is unknown. However, it is believed that acetaminophen reduces prostaglandin production in the brain, which causes the hypothalamus to reduce the temperature in the body. Prostaglandins are lipid compounds that have hormone-like effects. Usually, they are produced at sites where tissues are damaged or where an infection is present. The presence of prostaglandins causes inflammation and increases blood flow, which can lead to hemorrhagic fever in individuals with dengue fever. Other pain relievers, such as nonsteroidal anti-inflammatory drugs, or NSAIDs, should be avoided. These drugs keep platelets in the bloodstream from aggregating to form clots, which can lead to excessive bleeding in patients with dengue fever. There is a vaccine present called Dengue that exists for the prevention of dengue fever. The vaccine was mass marketed in the Philippines in 2016 and was given to about 700,000 individuals. The vaccine was later found to be effective at preventing dengue fever only in individuals who were previously infected with dengue fever. The selling of the vaccine was halted after complications such as internal bleeding in the lungs and brain were seen in individuals who received the vaccine and who had also never been infected with dengue fever before. Restrictions are now in place for giving the vaccine, and this vaccine is allegedly the cause of death for at least 65 children. Since there are no antivirals or low-risk vaccines present for the treatment of dengue fever, many researchers and organizations have focused on reducing the mosquito populations that are capable of spreading the virus. The main vector of dengue fever is Aedes aegypti, and Laos's main method of reducing mosquito populations is by dumping containers filled with standing water where the mosquitoes could lay their eggs. However, poor sanitation services in the country have led to sewage and trash buildup in streets, which are prime locations for mosquitoes to lay their eggs. Many people in Laos are distrustful of their government, with many viewing the country as being corrupt. In order for cases of dengue fever to be decreased, the government must initiate better sanitation services to decrease the amount of places that mosquitoes can lay their eggs. If the mosquito population decreases, then the cases of dengue fever should also decrease. Thanks for watching.